As we come together today to talk about leadership in healthcare, we need to acknowledge that our health systems have not treated everyone fairly and equitably. Our Mi'kmaq, African Nova Scotia, and other equity deserving groups have been and continue to experience shortcomings in our systems, and tomorrow's health leaders need to right these wrongs. And welcome to all of you. So now let me expand a little bit on the urgent need for health leaders, and that urgent need is across Canada and internationally. And I'd like to talk a little bit about how the MHA can set you up for a career in this fascinating, complex, and demanding field. I think all of us here have experienced how the COVID pandemic has changed how we work, how we study, and how and when we spend time with family and friends. It has also forever changed health systems around the world. Pandemics, we're told, are here to stay, and we can expect public health crises related to climate change and natural disasters to continue. So while this is a time of great challenge, it's also a time of great change and hope. I've watched as scientists work differently, openly sharing what previously would have been trade secrets and taken years to get to the public. We've seen international agencies cooperate and collaborate on solutions. And we this week especially have seen how health for wealthy countries is forever tied to the health of all nations. So if ever there was a time that health leaders were needed, this is it. So great timing on your part. Frontline health providers can only perform to their best in systems that have adequate supply of equipment and that work smoothly around them. Individuals and the public can only respond if they have understandable information and they receive it at the right time in the right way. In short, the public and the healthcare sector need strong leadership, critical thinking, and expert administration. And everyone now knows that we all depend on this. So here in the School of Health Administration, you will find some extraordinary people ready to help you succeed as a health leader. Our curriculum is designed for those with and without healthcare experience. And I promise you that you will find it equally challenging whether you have an economics background, neuroscience, ethics, or a healthcare background. Your teachers and mentors will be a blend of internationally recognized researchers, dedicated scholars and academics, and senior health leaders from neighboring institutions. Our school staff are all student-focused and ready to help. All of us believe in and will take pride in your success. Here you'll also find ways to tailor your learning to achieve your goals. For example, consider whether the coursework or the thesis stream program best suits you. Or perhaps you might want to combine your health administration degree with a law degree or a doctorate in pharmacy. All that is in the academic realm. However, academic success, however important that is only part of the equation for successful leaders. Successful leaders find mentors, they build networks, and they need to be constantly learning. Today, you'll hear about our Executive Residence Program, our Element Mentoring Program, the Professional Development Program, and events organized by the Association of Health Admin Students. These will add value to your formal education. But before you hear more about these from our amazing students and speakers, let me introduce Dr. Brenda Merritt, Dean of the Faculty of Health. Dr. Merritt is herself a strong health leader, overseeing the most diverse health faculty in all of Canada. Dr. Merritt has 2 undergraduate degrees, one in equine science, one in psychology, a master's degree in occupational therapy, and a PhD in education. She is an accomplished scholar, a researcher, an educator, and a leader. Dr. Merritt, thank you for being here and making the time to join us today.
Thank you, Dr. Packer. It is an absolute pleasure to be here, and I cannot believe it's been a year since our last open house. But I'm here to kind of welcome you from the Faculty of Health perspective. And as Tanya said, that we're the second largest faculty on campus. And the School of Health Administration is one of 10 academic units in our faculty. So coming here and studying and working in the Faculty of Health, you're amongst one of the most diverse faculties of health in Canada. So lots of interprofessional colleagues to learn about, from, and with. And we also have close partnerships with the Faculty of Medicine and the Faculty of Dentistry. So it's a very, very rich learning environment. And I know that our health admin students interact with all of these other students and actually bring a very unique perspective around leadership and not really that direct care model. So it's a really great mix of learners and researchers. And I would just say that I'm so excited about what is happening in the School of Health Administration. The research that is happening is just critical to our public health and leadership within healthcare systems, but also our students, amazing on-campus leaders, and going out. And you'll hear from some of our alumni tonight, and it's just, I'm in awe of the alumni that come out of the school. So I don't want to take too much time because I know that we'd much rather hear from the alumni and some of the faculty, but a warm welcome and thank you.